This is the computer-defined pump which has prescribed analgesics in the box with the protected unique key to access. Here is the regulator which delivers predetermined doses of PCA when patient activated button is pressed. Finally, the tubings. Access the Omnicell. Grab the drug with witness. With the unique keys, unlock the protected system and replace the old empty PCA pack with the new one. Make sure to prevent the air. Select new patient, enter the physician's prescribed dosages, which particularly has a lockout time and 4 hours limit and a reservoir volume. Select the task. Here, according to the policy and procedure of organization, PCA device is again protected with the unique code. This will from the misuse either by the patient or by near sitters. Once the volume is set, save the entry. Then go to the options to review. Here, it will help you to confirm the entries what you made. This step prevents the wrong entries as well as wrong delivery of medication doses. Once everything is done, start the button. Sometimes your machine may ask for the priming. Always disconnect the tube from the patient and then prime. Once priming is done, connect it back to the patient and press the start button and instruct the patient. Now the device is ready to deliver the dosage. As the delivering medicine is high alert, every data is stored automatically. This helps to prevent the discrepancies. And coming to the patient delivery logs, this has very important data, how much volume that have given and how many attempts the patient had made. This helps us to understand how well the pain is controlled and how the patient is improving. Finally, always monitor the vital signs of the patient. Ultimately, patient well-being is our important.